prevention, management, care and cure. Yeah. మా ఆర్గనైజేషన్లో అందరూ పేరెంట్స్ ఏనండి. దాంట్లో మా ఇంటర్నల్ బోర్డు కూడా పేరెంట్సే. అయితే మేము చాలా లక్కీ. మా ఫౌండర్స్తో ఆల్ ఆర్ కేర్ గివర్స్. అంటే మా పిల్లలు మస్కులర్ డిస్ట్రఫీతో సఫర్ అవుతున్న పిల్లలు. అయితే దీంట్లో ఇంకోటి ఏముందంటే, ఈ సఫర్ అవుతున్న పేరెంట్స్లో మాకు డాక్టర్స్ ఉన్నారు. వాళ్ళు డాక్టర్స్గా ప్రాక్టీస్ చేస్తూ న్యూరాలజిస్టులు కానివ్వండి, ఫిజియోథెరపిస్టులు కానివ్వండి, ఎండోకాలజిస్టులు కానివ్వండి, అండ్ డిఫరెంట్ కార్డియాలజీ, డిఫరెంట్ డిపార్ట్మెంట్స్ విచ్ ఈజ్ రిక్వైర్డ్ ఫర్ మస్కులర్ డిస్ట్రఫీ పేషెంట్ మేనేజ్మెంట్. We are coordinating with all these guys. At the same time, we are very proud to say that not only our parents as a scientist, our few of patients, say BMD and then LGMD and then other muscular dystrophy sufferers are also into the core area of the scientific field. We have internal boards with these doctors, scientists, at the same time the well-wishers and then other organizations also, to discuss the problem as a bird view. Our main vision also mission is to explore, assist, educate and support all in the most acceptable and feasible form. Our vision, find affordable care. That is the only first primary thing for us, care. And then if possible, cure. Solution to the muscular dystrophy at the earliest, and to be a facilitator in improving the quality of life to the impacted families. In Bharat MD Foundation, we have the members from all verticals of the life, which includes the lawyers, doctors, daily wage people also. Will give more support and then importance to know the problems of the everyone, because every stage will have their own different problems. We try to address that. Coming to this muscular dystrophy, I think that most of the audience here are the doctors. If we wish, I can skip this, otherwise I will go to in a brief explanation on this. These are all the type of muscular dystrophies, several types, and then this is typically a Duchenne muscular dystrophy person. Which are all organs will affect to a patient. One of our member come also today as a kid. He looks like, maybe if he's sitting in the seat, looks very fine, but all you know that the muscle related organs will get shrink day by day. We don't have any other option except accepting. And also in this, we have given that which are all body parts will affect with each and every type of the muscular dystrophy. This is the progression for a Duchenne muscular dystrophy patient. In India, if you see, on an average, 20 is the age. We have some few kids beyond that, they are extraordinarily excelling in their fields. And coming to our focus and then our approach, as all you know that as a parent advocacy and also the problem with there is no solution, we need to work with all stakeholders. That is what we are doing it. Means with the advocacy teams, can you be a little clear? Sir, are you able to see the? Yeah, okay. Yeah. If you can see this, we are working in a 360 degrees with all stakeholders, including the research members, public and private companies, the policy makers, and supporting system providers, drug discovery system, and scientists and research, and doctors and the hospitals. Along with all these things, we are working with all existing advocacy groups also. That is the most important thing. It is required at this stage for a rare disease community. Because as all we know that health is the state subject, but still the policy is making at the central. So any policy is making at the central, we have to utilize that at the state, and then states will have their own policies. So we have to work at these two different places to make sure that we will get the available facilities to the affected people. And in that process, we will always say that to deal these rare diseases with 5 A's. That is, first one is acceptance. Acceptance is for the parents and for their families. So once you accept that my kid is with this problem, so that you will move a little ahead and know what exactly is the disease all about, so that you create awareness for yourself, as well as if you can cross that, you can create awareness to the public and to the other stakeholders at a large. And approachable. Luckily, here we are putting our conference here. We have seen some of the places, including the hospitals also, we don't have a proper ramps to take my kids. Okay. So any place, including the doctors also, we should have a approachability and accessibility, affordable. That is the most important thing. As our VK Pauls we all know that the drugs are very expensive. For the muscular dystrophy, DMD, we have 2 drugs which we are regularly discussing also, with one-time infusion gene therapy that is costing almost 24 crores. And another one is the Givinostat, is like a daily medicine which we have to give it to our kids. The price is also very high. We got some few quotations for the Givinostat. It is costing somewhere around 72 lakhs to 1 crore per year. It is impossible for our Indian middle class families. And also we have put our efforts to give representations to the concerned persons with the DCGA and then CDSCA also. I have shared with our Ramaya Garu also earlier, and then we discussed also to bring generic version of this one. Yes, all we are discussing, this rare disease medications are not having the market. Sir, I am telling you that, especially for the muscular dystrophy, very particular with the DMD, we have good numbers, but only problem is that the guys are not coming out. I will tell you in my coming slides also how I am confidently telling that, because of the groundwork which we are doing it across the country, not only at Andhra Pradesh, Telangana, Kerala, Karnataka, and then all other states. Because we as a sufferers, as a parents, we are going to the ground level and then finding out how many number of people are there. And then this is the our physical programs and our efforts. We do all online awareness programs. We have our dedicated channels where we record all these sessions and then we will upload so that any newcomer or the one who missed those sessions, they can review those things so that they can get the awareness on that particular topic. Yeah, these are all the PMC initiatives. We believe in PMC concept. The PMC is prevention, management, and then care and cure, which I already told. So with our efforts, we are able to help 3,115 plus families from last 3 years. So thanks to the all stakeholders like IORD and then other state level organizations, they helped us to reach the needy people. So as Krishna Babu Garu sir also morning emphasized on the data, the importance of data. For this also we have given our representations at the central level to the Nadda sir also, health minister, to initiate the process for the rare disease registry. But we have been listening that they are doing this registry from the last 4 years. But as we all know that where it stands. So what we done was, so we parallelly started creating the registry after consulting all my internal board members and then industry experts, what sort of data is required to support these people. So I can say that today we have around 8,000 plus exclusively DMD kits data with us. But unfortunately, this data is the very dynamic. Why I am saying this data is a very dynamic means, we have done a program 2 years back at ISKCON with the 78 kits. That is on 2022. Now we stand at 2025 early, in the very beginning of the 2025, just only 2 years. Now we lost more than 28 kits in that 70 odd kits. And also the condition of each kid is getting deteriorating day by day because the time is the muzzle for our kids. So until unless we have a dynamic data with us, we can't help these people also. You people can ask that, what you people are done with this data? Yes, we helped our kids. As all we are discussing about this Center of Excellencies, 12. Out of 12 Center of Excellencies, in 9 Center of Excellencies, some clinical trial has taken place. Using this data, after filtering the data, identified eligible candidates, then given to the nearest COE or a trial site. Because not only COE, VIT, Vellore Institute of Technology, there also we have the clinical trial sites. At Bangalore also, along with the NIMHANS, Aster Hospital is also doing the trial. Even at Ahmedabad also. We have given the data, but after receiving the data also, 30 kids are got disqualified because the process started for the identifying the qualifications, all the protocols. The moment they start the actual infusion of the drug, these guys got disqualified. So, any decisions or any actions, it has to be as quick as possible if at all we are trying to help the kids. Otherwise, we lose. So, this is the situation where we stand now. Yes. Coming to the all prevention things, we have done a few things. As I already told that we are working with all existing organizations who are working for this rare disease. While I am discussing in detail with the Ramaya sir also, I used to express myself, sir, sometimes we are not able to move with some people. He advised that, see Murali, if you want to help the kids, keep all your things aside. See what good things they are giving to your community or your kids. Move with them. Sir, I will take that advice. I'll try my best to, follow the same thing. Not only me, my entire organization also. And also one major thing which we have done here is, we have so many muscular dystrophy associations in all the states. In one state, we have more than 1 or 2 or 3 also. We try to bring them all them in one agenda, told them that our main aim is to get the best out of available sources. Try for that. You have your own individual agenda. The reason we have the tie-up or the collaboration with the World Duchenne Organization, Cure Duchenne, and other PPMD, and our local thing like IIMD and the PPMD India, and like that. And also our presence is there in all these states. So how we are operating also, almost every state, the active association is working with us, will move with them. If not, the parents who are active there, they themselves are taking as a charter in charge, and then they are executing the things, and then we are helping each other. Because if you see, the help is providing different states. The Kerala is a different approach. Tamil Nadu is a different approach. Karnataka is a different. Andhra Pradesh, like that, every state will have its own approaches with the health policies. We are trying to bring all these things at one shot and then see that which suits for the other states also and do that. We all feel that Bihar is a very backward state, but the collaboration and the working at the ground level by especially the muscular dystrophy parents are excellent. How they are working is, I felt that I can meet our VC of the health university, because why I am mentioning that one is, they are working with the all government colleges, that if at all is any new case is noticed in their colleges, it is coming to their head office, so that Bihar government is giving one time 10 lakhs rupees as a support to the each muscular dystrophy patients. They have worked excellently that way. So we are trying to adopt whatever good things are there in other states to the other places also. Yeah, as I told that the prevention, even I mentioned also while I am discussing with Krishnaji Raoji, that we have done our genetic camps from the 2022 onwards. It happened to, done at our Vijayawada also, with the collaboration of with the ARDO also that time. So we collected around 48 samples. At that time we are doing only collection of the samples from the patient. After that we planned that this is not the way where we can prevent the disease in their families. That's why we have gone beyond that and done a good number of programs where we taken the extended pedigree charts of the families and then taking the samples from the patient, the parents, the siblings, and if the patient is married and then have got the kids, we are taking their samples also and then giving to the local persons or the associations or the charter people to do the genetic counseling. But Here we are finding a lot of difficulty to find the right people for the genetic counseling. The lack there is also there. Yeah, as I told you that in the care, we are doing some, support because the muscular dystrophy patients required BiPAP missions at the later stage, maybe at around 13 years afterwards, because their diaphragm also will become weak. So we are providing the BiPAP missions to them also to not solve their problem, but just to extend their life, maybe a quality of life. The same way we have done, few programs, and then first Bosho games, that is only the game can play by a wheelchair users, especially the muscular dystrophy guys. So we have done our first Bosho games at Hyderabad. We are planning the second, Bosho games program in coming March 23rd. And it happened to, the Met, then Telangana Governor Rangarajan at NIPID in one of the program for creating the awareness. So at the NIPID, we had our one stall also there. Some few, awareness programs across the, places at Neelofer and then IOG, and also it happened to, attend one of the program, and then we did one program at Bangalore where our previous CJI, Chandrachud sir also joined. I don't know, I think that most of the people aware that he is also a father of a rare disease. His both daughters are suffering with that myotonic. Okay. And actually, his wife is running another foundation. She connected later, knowing that this groundwork we are doing it, and then he is also advising us that, I will make a guidelines for any, rare disease cases comes into the court, so they can consider these guidelines while giving the verdict, which we discussed also, sir, over our previous discussions. Yeah, these are all the places where we have done our activities, which includes the Telangana, Gujarat, West Bengal, Bangalore, Hyderabad, and then at Bangalore. So many other places also we have done it. Yeah, this is the current project which we are doing it with the collaboration with the CDFD, mega free genetic investigation camp for muscular dystrophies with the help of the other, the stakeholders, where we are going into the rural areas of the Telangana and then collecting the samples. The same process, we have done it at Kerala, Gujarat, West Bengal, Bihar, and then we are discussing with the Andhra Pradesh, the partner also. If they come forward, we are ready to extend our, service for that. This actually, they have taken it as one project. They targeted for 5,000 samples for a duration of 3 years. Yeah, with our, the contacts and the other reach, now, just 3 months back only we started this one. By now we already given 5,000 samples to them. So we are requesting them, you increase that number of samples, at least to 50,000, not 5,000. So they thought that we won't get the samples. And also we clearly giving a detailed, supporting documents for them so that no single sample will be wasted. They can do directly, they can identify the type if they can give the result to us, which will help us to take that back to the families and then request our genetic counselors to help their families to prevent the, their diseases. Because we, found out, especially in Warangal and in Nalgonda districts, few families with 5 to 6 generations. ఎట్లా తెలిసిందంటే అండి, సమరం గారు వచ్చారు, నేను తెలుగులో మాట్లాడాలనిపిస్తుంది, నన్ను తెలుగులో మాట్లాడనియండి. మేము ఒక ఫ్యామిలీకి శాంపిల్ తీసుకున్నామండి. తీసుకుంటే ఆయన మా దాంట్లో రిజిస్టర్ చేసుకోలేదు. సార్ ఇంకో పేషెంట్ ఉన్నారు, మేము ఆ శాంపిల్ కూడా మీరు తీసుకుంటారా అన్నాము. ఏంటి రిలేషను, ఆయన ఈ జెనెటిక్ డిజార్డర్తోనే సఫర్ అవుతున్నాడని మీరు ఎలా చెప్పగలుగుతారు అని అంటే, ఏం లేదు సార్, ఆయన మా అమ్మ వాళ్ళ అమ్మమ్మ చెల్లెలు మనవడు. సో నాకు కజిన్ అవుతాడు. అయితే ఏమైపోయిందంటే మా ఫ్యామిలీస్ అందరూ పొట్టకూటి కోసంగా అందరూ బయటికి వెళ్ళిపోయారు. మేము ఎక్కడికి వెళ్ళలేక ఇంట్లో ఉన్నాము. నేను ఒక్కడనే రాగలిగాను. మా ఫ్యామిలీ వాళ్ళందరూ ఉన్నారండి, తీసుకురానా అని అడిగాడు సార్. తీసుకున్నామండి. ఎన్ని శాంపిల్స్ తీసుకున్నామంటే మేము 19 శాంపిల్స్ ఫ్రమ్ దోస్ 2 ఫ్యామిలీస్ హూ ఆర్ స్టేయింగ్ ఇన్ దట్ పర్టికులర్ విలేజ్. మేము అనుకున్నాం యాజ్ ఎ పేరెంట్ అడ్వొకసీస్గా మేము అంతకుమించి ఎక్కువ చేయలేము, శాంపిల్స్ తీసుకొని చేయగలుగుతాము. నేను ఇమ్మీడియట్గా సిడిఎఫ్డి వాళ్ళు, సిఓఈ వాళ్ళతో, ఎందుకంటే మీకు ఆల్రెడీ వర్క్డ్ విత్ ద సిఎస్ఐఆర్ ఐజీఐబి ఆల్సో ఎర్లియర్, వాళ్ళని మేము అడిగాము ఇలా ఉందండి ఏంటి అంటే, వీ విల్ టేక్ దోస్ కేసెస్ డైరెక్ట్లీ పుట్ ఆన్ టు అస్. లిటరల్గా చూడండి, వాళ్ళు ఒక పిడిగ్రీ వేస్తే పెద్ద క్యాన్వాస్ దొరికిందండి. దాంట్లో 42 మంది ఫ్యామిలీ మెంబర్సు ఎఫెక్టెడ్ ఎట్ డిఫరెంట్ లొకేషన్స్. We are now after those families to get the samples to help at least that family. ఇంకొక చిన్న ఎగ్జాంపుల్ చెప్తానండి, మన ఖమ్మం నుంచి సార్. ఆ ఫ్యామిలీలో మేము తీసుకున్నామండి. మదరు 72 years, ఆమె 4వ బిడ్డ 62 years, 6వ బిడ్డ అరౌండ్ 50+ ఉంటాయండి. వీళ్ళు ముగ్గురే ఆ ఫ్యామిలీలో ఇప్పుడు బతికి ఉంది. ముగ్గురు కూడా పేషెంట్సే, వాళ్ళకి ఏమీ లేదు సార్. లక్కీగా ఏంటంటే రాజశేఖర్ రెడ్డి గారు ఆ టైంలో ఉన్నప్పుడు ఆయన చేత్తో రాసిచ్చాడంట, వీళ్ళకి పెన్షన్ ఇవ్వండి అని. ఆ పెన్షన్ ప్లస్ ఈ ముస్లాంకి వచ్చే పెన్షన్ అంతే. బాగుందండి, కనీసం అదన్నా వస్తుందని మేము హ్యాపీ ఫీల్ అయ్యాము. కానీ ఇప్పుడు ఇంకొక చిన్న సమస్య వచ్చిందండి ఆ ఫ్యామిలీకి, అట్లాంటి ఫ్యామిలీస్కి. ఏంటంటే నౌ సెంట్రల్ గవర్నమెంట్ ఈజ్ టేకెన్ ఎ డెసిషన్ టు క్లబ్ ఆల్ దీస్ సదరమ్స్ ఇంటూ దేర్ UDID. సో ఎనీథింగ్ కమ్స్ నౌ త్రూ UDID identification only, irrespective whether you have Sadram certificate or get by your local medical board or not. Through that only they will give. We are discussing with the families to, give these, at least help them out. Yeah. With this, I have so many things to present, but it is a never-ending process. But at least I'm able to give my presentation till these 2-3 cases. Thank you for again to the IOD, Ramay garu and Krishnaji Rao garu and the entire team. Thank you.